Thank you so much. Thank you for inviting me. So yes, I'm going to talk about the welfare mandate hypothesis, insight from healthcare access for irregular migrants. So basically in this paper, we use like this natural experiment, a policy change that happened in Spain in 2012, which restricted access to healthcare for irregular migrants. And so the welfare mandate hypothesis sort of predicts that this could deter migration, and we wanted to test this empirically in this paper. So the main motivation comes from the fact that, of course, this is like, we think that this is an important question, but also, like as Alex said, no, I think this is a very sort of hot topic nowadays because a lot of political discussions now sort of assume that this welfare mandate hypothesis is true, and especially like some right-wing politicians, they argue that immigrants, especially like low-skilled immigrants, they take advantage of welfare programs of the countries of destination, so it could work as a pull factor, which welfare system in the country of destination may attract more immigrants, and especially like low-skilled immigrants who are not going to work. And for that reason, a lot of countries have restrictions on immigrants accessing welfare programs. So like some countries would have restrictions that you need to have a residence permit, for example, to access healthcare or to access some monetary benefits that this country offers. But like in some countries, the politicians would even argue that only local people, no, only citizens can access welfare benefits. Immigrants should not access it because it attracts this.
Sorry, when you say immigrants, you mean irregular immigrants?
So again, it depends. No, some countries, like for example now in the US, like regular migrants may have problems in accessing some of the benefits. Like usually in Spain, it was affecting only irregular migrants. That's correct. Yeah. So here you can see just some like examples from news, recent, not so recent. Like for example, Marato, which was mayor of Vitoria from Partido Popular. For example, he said, "Los inmigrantes magrebis vienen a vivir de las ayudas sociales," so like immigrants are coming to live on social benefits. Again, assuming that there is this welfare mandate hypothesis that this type of migrants, they come only because of social benefits. Or like, for example, in Valencia, PP and Vox reached an agreement that only Europeans may access aid from the government, from the local government, again to stop this unwanted migration. So again, here they implicitly assuming that this welfare mandate hypothesis is true, that if you stop giving aid, social aid to these people, this may stop migration. And like, of course, the example from Trump's campaign, that, for example, Trump recently restricted access, or discussed restricting access to healthcare for specific type of migrants. So here it was from deferred action for childhood arrivals recipients. So these kids, like immigrant kids, could not anymore access to healthcare. Again, here, of course, the main motivation was to stop migration, as a lot of Trump's policies. So therefore, in this paper, we want to test whether this hypothesis, this mandate hypothesis, is true. So we want to test whether such restrictions, or whether restricting access to social benefits to migrants, in our case, to irregular migrants, may actually deter migration. And so here we are going to use policy change that happened in 2012 in Spain. So basically the main change was that prior to 2012, access to healthcare was universal, so anyone, independently on one's administrative situation in the country, could access healthcare system. Like the only thing that you needed is to be registered in municipal registry, like in Padrón Municipal. And in principle, to register in the municipal registry, you didn't need to have a legal residence permit. so anyone could register. Of course, in practice, there is some anecdotal evidence, like that some cities would deny to give registry to irregular migrants, but by law they were eligible to have registry in the municipal registry, and therefore they were also eligible to receive healthcare cards. So in 2012, also of course related with the fact that Spain was in the recession, the government issued a law that basically restricted access to healthcare to irregular migrants. So you had to, starting from this point, you had to be regular, you had to have a permit to be legal in Spain to get your healthcare card. Yes?
But wasn't this overruled by some of the city halls? My understanding is.
That's correct. So in some autonomic communities or in some cities, the reform was not completely implemented. And this is like, let's say, something what we are now working on. So we want to see, like up to now, the paper focuses on nationwide effects. So whether immigration or like at the national level. But like the next step what we want to do is to look precisely at that. We want to look whether in different places where the reform was completely implemented, the responses were different, because like that's a super interesting thing. And there is also exactly, because like we know like there is basically data that tells us like how what's the degree of implementation of this law in different autonomic communities. I don't think that we can go like to the city level, but we can go to autonomic community level. So like I hope like in a couple of months we're gonna have an answer to this.
And just another question. And do you know which is the situation in other countries because of that? So that if they are not coming to Spain, are they going elsewhere? So
yeah, like it's sort of heterogeneous, no, in other countries. I think
close.
Yeah, exactly.
Close
like exactly. So to be honest, like I don't have it on top of my mind. I would say that Spain is like one of the most inclusive healthcare situation. Exactly. Like in most countries, you would need to have permit. Like to us, the important thing that there is no sort of same change happening at the same time in other countries, you know, that could affect that now migrants are going to different countries. But yeah, I will check like what about the situation in other countries. I would say that Spain is one of the most inclusive healthcare system. All right, so we're gonna use this change to study, to test our hypothesis. And so what we're gonna do, we're going to compare migration flow. So we are going to conduct a difference in difference. This is our main specification by comparing migration flows from countries which could not be affected by the policy, which were not affected by the policies, which are European countries, because even after the reform, like all Europeans, they were legal in Spain and they could access to healthcare. Also, they could use the European healthcare card. For non-Europeans, this is not true. No? So after the reform, they had to, their situation was affected. So here, the important thing is that, as I said, no, the reform supposedly was supposed to affect irregular migrants. And this is, let's say, the data limitation that we have, because the initial idea of this paper, we wanted to look only at flows of irregular migrants. No? The thing is that it's very difficult to measure irregular migration in the data. So we have data on permits, but this data is not great quality, because basically, like for example, if you are in Spain with 10-year permit and then you leave Spain, you're still going to be in this data. So the data is not getting updated very well. So for that reason, like basically we see that the stock of regular migrants is just like constantly growing, because people never leave this stock. So it's quite difficult to observe dynamics in this irregular migration. Yeah.
And also the data from migration comes exactly from the padrón. And if they are not registered because they don't have incentives, then you're going to miss out the irregular ones anyway, right?
They still have incentives, because it's true that healthcare was one of the incentives, but they still have incentives. Because, for example, if they want to send kids to the school, they have this incentive, you know. So we are going to use data on padrón, because this is the only data that that we have. But for, like, if you want to measure only irregulars, then it's going to be like what we could do in theory is to compare everyone to legal and compute the difference. But legal migrants is not something that we observe very well in the data, because like if I'm legal and I leave Spain, you will not observe this change in the data. You will still observe that I'm legally in Spain. So you will not, it's not possible to observe very well these dynamics. So for that reason, we sort of focus on everybody. We don't restrict on irregular migrants. So we focus on the overall flow of migrants, regular and irregular. And also, like, there's a lot of anecdotal evidence that basically what was going on is that at healthcare centers, they didn't even know like how this policy works very well. And so if someone with students, they were affected, no, but someone with work permit comes, they may deny your health card because they think that you are still a migrant and you are not allowed to have this card. And this, of course, there is no data on this, but this comes from like multiple reports from some NGOs saying that people were complaining during this period that they were legal, but still they were denied access to healthcare card.
Sorry,
yes.
Restriction, what does this imply? So are there minimum services like emergency, whatever, illegal ones? And then if they get those services, do they have to be paid?
If they get the services, they have to pay? No, so like, in general, like for example, pregnant women, or if it's an emergency situation, you will still access it. You don't have to pay. But like for all other cases, like planned healthcare and so on, like primary healthcare, no, you don't have healthcare card. But yes, if you break your leg, you can go to the emergency room. Yeah, you don't have to pay for that. Whether the policy was salient. So first of all, we know that the policy was salient not only in Spain, because like it was largely covered by media, but even in the countries of origin, it was covered by media. Like for example, in countries like which is very common origin countries in Spain, like Morocco or Colombia, in some newspapers they would discuss that Spain now has restricted access to healthcare for irregular migrants and so on. So people knew about this change, and of course, Spanish people knew about this change because it was highly covered by the media. But apart from that, we also know that something was going on. The policy didn't it was not ignored, because there are some studies, for example, Juan Marti, Mestres and Waters, they show that basically they use some similar estimation strategy to us, and they show that the policy was associated with increased mortality among migrants. Then the paper of Jimenez Rubio and Val Costello, they show that there was worsening in self-reported health and system perception. So here they use survey data. And for example, Bello Sobrero and others, they have shown that policy was associated with lower reporting of intimate partner violence, and basically healthcare is the main point to report, like the main place where usually women would report this type of violence, and if you restrict access to healthcare, they would not be able to report it as well. And here they also focused on all the migrants, not only on the regulars, so for that reason we believe that if the effect was there, we would observe it. So the literature where we contribute. Of course we contribute to the literature on welfare magnet hypothesis. And here the literature is quite wide, but I would say that it's like a lot of papers are descriptive. Like for example, there is this very well-known paper of Borjas 1999, which shows that welfare recipients in the US were more clustered in high benefit states. So this is consistent with this welfare magnet hypothesis. But of course, it's not causal, no, because these different states may also be different for other reasons, or like, for example, maybe older people will be in these places, and so on. So you need to control for, like you need some sort of randomization, some sort of natural experiment to say confidently that this hypothesis is true. And also, like this paper is interregional. Here we focus on international migration. Then, for example, another paper is Pauschal, which 2005. They have a natural experiment from state level against state level policy in the US, and they used variation in federal benefits. They found no effect, so no evidence which sort of goes like in the opposite direction from Borjas. Then Ferveda, they use regional variation in cash transfers in Switzerland, so it's a bit closer to us, not as close to Europe, no effect. And then paper which is sort of related to ours. So here, like, I want you to notice that like most of these papers, they use cash benefits. And we believe that it's also possible that people respond differently to cash benefits than to in-kind benefits, just because of some like psychological mechanism. Maybe you do not mentalize the same way money and in-kind benefits. No? And we know that there is massive evidence on differences, for example, in responses to cash and in-kind. So here it could be the same. No? Maybe people move to places if you offer them money, but they would not move to places when you offer them healthcare of the same value than this money. But for example, Rigzin, they also use variation in healthcare in the US. So during the Affordable Care Act, there was a Medicaid expansion in the US, but this expansion didn't happen at the same time in all states, so it was like a staggered implementation, and they used like they took advantage of this staggered implementation. They found no effect on immigration, but they found a small decline in out-migration, so it could be consistent again with well-formatted hypothesis, but quite weak, let's say, the evidence. So all these papers are interregional. Then there is just two, to the best of our knowledge, papers which are national level. So first of all, the paper of Boeri 2010, which is basically descriptive evidence, which shows that there is self-selection of low-skilled migrants to the countries with generous welfare states in non-contributory benefits. But again, it's fixed effect, basically country fixed effect. Some other things could be going on. People could be attracted by other things that are correlated with these welfare states. And then there is a causal paper by Anastasia Terskaya. So they used a 2024 in Denmark, which basically reduced lowered benefits for non-European migrants. And like they have like this very beautiful event time figure where we show one of the authors is Cleveland, so this typical Cleveland's paper where everything is perfect, so you can see like this constant trend in migration, and then after the benefit reduces, the migration goes down, and everything is perfect. No? But then there were like a lot of discussions also in the academic world, like for example, Dussmann and Walters, they were criticizing this paper, saying that they find evidence, for example, that crime increased because of this benefits reduction, or for example, labor market outcomes got worse. So if these immigrants really left, why there are effects on these other outcomes? So our main contribution, like we contribute to this literature, but first of all, like our main distinction from this literature is that we focus on non-cash benefits, and I think it's super important, this distinction, because like for example in Spain, we know that Spain spends quite little on cash benefits, while it spends a lot on healthcare. Healthcare is the second largest item in public expenditure in Spain after pensions. So of course understanding how people are attracted, how people are reacting to this kind of benefits is super important, and it could be very different from cash benefits. And I think still in economic literature there is this tradition to extrapolate from the evidence on other types of benefits, saying like these people found something for cash transfers, and the same thing is going on for healthcare or for education. It might be not true. And like most studies that used national level effects, that looked at national level effects, they are descriptive, with an exception of this paper of Agarsnap and Quaters in 2012. So here basically our main contribution is to provide quasi-experimental evidence using in-kind benefits on the existence of this well-formatted hypothesis, well-formatted effects. And so, like, be a little spoiler before I show you, like, I move to the empirical strategy and results, is that we find no evidence. We find that immigration flows didn't change around the reform year, and there is no evidence that the effects were negative. We find no evidence of the reduction in migration. All right, so if there are no questions, I will move institutional setting. So the reform was implemented in 2012 after the Partido Popular, Popular Party in Spain, got to the government, got power. The thing is, like, the nice thing about this reform is that it was not announced before, like it was not specified in the political campaign of Partido Popular, but rather it happened sort of unexpectedly once they were already in power. So again, prior to the reform, everyone had access to healthcare, so you just needed to be registered in Padrón Municipal, which here I do agree that it still could be that we are not touching some people, because it could be that some governments are restricting, like they are not giving the registry to irregular migrants. There is not a lot of things that we can do about it. What we are doing now is like a project in progress that we have. So we are planning to conduct a survey of irregular migrants. So we want to do take advantage of this regularization that is coming now. And we want to conduct a survey to irregular migrants, and we want to ask them like whether they have a registry, why, for example, they were denied in the registry, to see like if it's actually like an important issue, if there are a lot of people who are not registered, if there is a lot of illegal migration, which is basically completely unobserved in the data. But it's very difficult thing, like it's up to now it's been super difficult to plan this survey, because it's very difficult to get like a sample of irregular migrants. But like if I have time in the end, I will talk a little bit about it. So in April 2012, government issued Royal Decree Law titled Urgent Measures to Guarantee the Sustainability of the National Healthcare System. So basically the motivation for the law was that we are in crisis, we need money, we need to restrict access to healthcare to everyone, especially to the people who do not contribute to the system. So the main change is that after the reform, now you would not access basic healthcare. With some exceptions, as I said before, like for example, pregnant women could still access it, or like if it's an emergency, through the emergency room, you could still access it. And the important thing, like in Spain, during this period, during the economic crisis, a lot of people became irregular, because usually like your permit depends on your on having like a legal job, on having work contract, because of course during the crisis Spanish labor market suffered a lot. A lot of people lost their jobs, and for this reason they also lost their permits, but they stayed in Spain working illegally. So therefore it was quite an important shock for many people, and we know that from the data from Health Ministry that about 873,000 health cards were revoked. So potentially it could affect a lot of people. We have tried to get this micro data from them. Nobody responded to us, so it was quite difficult to get to know which people left, what was the which people were affected, what was the age, what were the countries, and so on. Then after Social Party came to power, the policy was partially, not completely revoked. And I think in 2022 it was completely revoked. So now we are back to prior to 2012.
So if you are irregular pregnant woman and
irregular,
yeah. And you give birth here, what happens with the kid?
What happens with the kid? To be honest, like I'm not sure completely what happens to the kid. I think Spain doesn't give you the nationality by birth, so the kid would be irregular kid or something. Exactly. But yeah, so I said that there are some exceptions, so kids also were included into this exception. Like young kids were included, pregnant women were included, emergency was included. So probably your kid will be covered, let's say, but yeah. So the identification that we use, we are going to compare European Union and European Free Trade Association immigrants, because basically before and after the policy they still were legal in Spain and they could legally access healthcare. The treated group for us is going to be immigrants from, like flows of immigrants from non-European Union or non-European Free Trade Association countries. So the main strategy is difference in differences. We're going to compare, it's just simple difference in differences, because here the reform was just one implemented the same year, so there is no staggered design. We don't need to worry about fixed effects and about all these new differences literature which is growing so fast. Like the new thing that we are doing is that we are using also synthetic differences and differences. So synthetic differences and difference, like basically when instead of comparing our treated countries to all control countries, we are going to compare them to the weighted sum of these control countries, such that the pre-trends are balanced, so they are following the same pre-trends. And
are you concerned about the fact that the migration itself is endogenous, or are you...
Migration in?
Migration is endogenous, right?
Yeah.
I guess that you're not concerned because you just want to look at this change. So as
it's
long as
the outcome for us.
change,
Exactly. It's the outcome for us. Exactly. But also it's the outcome for us, no? So like of course it's endogenous. We are not...
Yeah, so that's why, I mean,
yeah.
There is this very well used instrument for migration, right? It's based on this shift share. But you're not
no, we don't need, because we are not using migration as an explanatory variable. No, we are using it as a...
No, we use it as an explanatory variable, but it's endogenous.
But we are not using it as an explanatory variable. No, it's our outcome. So we are.
Yes,
it's our outcome. Exactly. Yeah. So like, of course it's endogenous, but it's an outcome. So we are exactly. So for us, the important thing is that sort of there were no changes between 2012 and like prior, before and after the reform, which could affect differently people from non-European and European countries. And like in the difference, we are also controlling for a lot of things. Like for example, we are controlling for, I will explain it like in one slide, but like we sort of like control for a lot of things. So this is the main strategy, non-difference. The second strategy is triple differences. So we also now say, okay, maybe people are actually like migrating for different reasons. Maybe people from Europe and non-Europe are migrating for different reasons. So there could be some non-parallel trends going on. So what if we compare migrants who are going to Spain? So what if we compare differences between non-European and European migrants who go to Spain to the same difference for other countries of destination? Like for example, here we use Portugal and Italy because it's sort of similar cultural countries, neighbors of Spain, so it could be known that these migrants decide to migrate to Italy or Portugal instead. And because of also data availability, so for example for France, we wanted to use France. It was a mess to find like nice balanced data because we needed data for migration flows for the country of origin, for the country of destination in each year, so it was not super easy for some other countries. Additionally, what we do, so we also say, okay, here maybe European and non-European countries of origin are not super comparable. What if we focus only on non-European countries, but we divide them into countries with high and low share of irregular migrants? Because remember that the reform was supposed to affect only irregular migrants. So here we would expect, if the market hypothesis is true, we would expect that the flows from the countries with high share of irregular migrants would decrease more than the flows from the countries with low share of irregular migrants. As I said before, irregular migration is difficult to measure, so for that reason we are not using it as an outcome. Instead, we constructed like a proxy of share of irregular migrants prior to the reform, and we just divided these countries into two groups, above and below the median share of irregular migrants. Okay, so I will discuss it like now. Yeah.
Can you explain the use of net migration?
The use of
yeah, because
right here, flow. Yeah. So basically, what is net migration? It's how we define net migration flow. So because we do not observe in migration, out migration, instead of that we observe stock of population in 2 years. We observe stock of population, for example, now in 2026 and 2025. So I can assume that the difference in stocks is the net flow of migrants. What's the problem? The problem is that some people between these 2 years could obtain the nationality. So for example, an Algerian person in 2026 now would appear in the registry as a Spanish person. No, and like if I do not consider this, I would naively think that this person left the country, but this person didn't leave the country. This person just went nationality. So we adjust, so we sort of add up the number of acquisitions of nationalities to this net flow. So therefore, the net flow is defined as differences between stocks of people from country of origin with nationality O in year T minus stock of people from country of origin O in year T minus 1 plus nationalities which were obtained by people from country of origin O in year T, okay, between these 2 years. And then, because of course from some countries these flows will be always higher than from another countries, just because these countries in general have bigger stock of migrants or they are bigger countries, what we do is we also divide this by the stock in 2008. So this variable can be interpreted as the percentage change in stock compared to the stock in 2008. Yeah.
So the stock of population, where do you exactly get it from? So it's like these registrations or permits in the municipalities, or you did talk about it before?
Yeah. So I have here a slide on the data, but basically it comes from INE, from statistical. INE is you all know what is INE. So. It comes from Padron Municipal, so from municipal registry, and basically like you can have access to microdata, but there is also like macro data, so they also provide just data disaggregated by country of origin, so we could just download the data from there. Yeah, now like to do this thing that you said before, like to look at differences by autonomous communities, we are looking now at the microdata as well, but we are still there. Right?
Sorry, the first year is 2008 of the period.
Of our period, we start from 2008 because we also didn't want to go like too far because there could be like more differences and
because I was worried that there are countries that join the EU.
So we do not include them. We do not include them. That's correct. All right. So the net flow, I think it's clear. So what's the strategy? No? So we are going to regress net flow on the interaction between non-European Union country of origin and year of greater or equal than 2012. No? So this is our main difference. Parameter B1, beta 1. We are controlling for two-way fixed effects. So we are controlling for the fixed effect of country of origin, which sort of allows some countries, like for example Morocco or Colombia, always to have bigger flows. And we are controlling for year fixed effect, so which also allows, for example, all the countries, all the immigration flow to be affected by the common time shocks, which is of course super important during the recession. Important thing, we also control for some controls specific for the country of origin and year. Here, super important control that we are including is time fixed effects interacted with GDP of country of origin in year 2008. So we basically allow countries with different level of development to follow different time trends. Because of course, here we can say, how should I believe that Finland and Morocco is the same? Also here we sort of allow Finland and Morocco to react differently to recession in Spain, for example. We also include GDP of country of origin, population of country of origin. We also include lack of unemployment rate in Spain, so we went to labor force survey data, like microdata, and we could compute there what will be, what was the unemployment rate. For example, here we do not do it by country of origin, but we do it by region of origin. Like what was the unemployment rate of people from North Africa in 2008, for example, and we included this control, again, to allow different countries to be differently affected by the economic crisis, because all of this is happening during the economic crisis.
Sorry,
yeah.
Can I go back to the measure, see if I can get that in my mind?
Where are we? Which slide?
The definition of the flow.
The
net migration. Because, okay, if I understand that, your difference between the two stocks before the policy takes place contains regulars and irregulars.
That's
right?
true.
In principle, that's what it means. once the policy takes place, if it affects, then that difference only reflects regulars.
No, because they still could register. So the policy was not.
Okay, no, wait. I'm saying if the policy works in the sense of throwing out irregulars,
okay.
once you implement the policy, that difference
Yeah.
will be made up basically of regulars.
Because it's like
So assume that you know this is true.
Okay,
If the
assume
policy
that
does have an effect.
irregulars left.
If the policy does have an effect, that difference only contains
Yeah,
regulars.
that's true.
Right? So actually, if the policy affects, when you do the difference between pre and post, you are comparing a period in which the difference only contains regular with another one that has both. So my thinking is, what are they actually picking up there?
So
You see what I mean?
at this point, like if it's true, no, so you're saying all assume that all irregulars left.
Yeah,
no?
exactly.
But
So
then-
let's assume that it happens, okay?
Yeah. But then in 2013, I should observe the drop because all irregulars left, so it should be affecting the net flow. So here, of course, like it could be that the reform affected only in 1 year, so everyone left in 1 year, and then flows would sort of like continue following the normal path.
No, but my question is not about that. It's about what exactly are you measuring when you're comparing this difference pre-policy and post-policy. Because pre-policy, you know that this difference contains regulars and irregulars.
Yeah.
Post-policy, if the policy is working, that difference only contains regulars, right? That's why.
No, for sure, exactly.
So when you compare both measures, which is what you do there, with the difference, but in essence, that's what you do. You are comparing the difference in the stock in one period in which the policy holds with the difference in the stock in one period in which the policy doesn't.
Yeah.
But those differences, pre and post, contain different people if the policy holds.
Yeah,
right?
no, for
So
sure.
exactly.
To me, the interpretation is that it is just net flow of immigrants, no? So I cannot say that this is a net flow of regular migrants, or I cannot separate. Like with this variable, I cannot separate. The thing is that, like, if what you're saying is true, I still should observe that at least, like, in the first year of the reform, there should be like a drop, like all irregulars left, so the flow goes down.
If the trend is constant, yes.
No, exactly. Like suppose that there are not trends.
So if every year the same amount of people come,
correct. Exactly. Then I should observe that they fall, and then I should observe that it sort of like stabilizes. No, we don't find that. No, but I don't know. I need to think like if this is actually like an important issue, like this composition. To me, I don't know.
if you really want,
yeah.
I mean, if you claim that you are measuring an impact on irregular migration, to me, it's hard to claim that based on the data that you have, but I understand all the problems it has, okay? I'm not trying to. It's simply that I think you are comparing two things that in principle, as you said, are composed of different people. Right.
No, for sure, yeah, exactly. But to me, the important thing is that, again, if this happened, if the reform is true, I should observe that in 1 year they drop, at least in 1 year after the policy. No, like in the short run, they should drop. And no, we don't observe that. No? So as I said, we sort of see that everything is clear. No? So for that reason, I don't have a reason to believe that the composition really changed. No? So you can think about like, maybe now there are more regulars are coming, no? Because now they are attracted by the fact that there are more regulars. But it's a bit like far-fetched, I think, no? To believe
sounds a bit
composition. Exactly. Yeah. So like if what you're saying is true, at least in 2013, I should observe this drop. And after that, it could stabilize. I do agree. Like it could be that people leave in 1 year and then they continue. No, there is no changes in the flow. All right. So
to answer this question, you can just show some, or let's say, some aggregate percentage of migrants being host if there are some like aggregate data.
There is no like. Yeah, I mean, we could use our dirty measure of regular migrants. Yeah, we could try to see like if the changes in permits changed. But as I said before, like it's very difficult to trust the dynamics of data on legal migrants just because like people do not leave this database. Like once you arrive to Spain, you receive your 10-year permit, you're going to be in the database for 10 years, even if you live in 2 years. You know,
but even a survey.
Just a basic survey just in 1 year. In 2007, we use it. So we're actually using some of the data on irregular migrants, so I will show it to you. So the data that we use comes from INE, comes from municipal registry. Then we also, for other countries, Portugal and Italy, we also use data from Eurostat. So we use similar measures of migration flows from Eurostat, migration stocks and acquisitions functionality from Eurostat. We use controls for country of origins characteristics that are time varied from World Bank database. And we also use the European Labour Force Survey to construct, for example, unemployment rate of people from region of origin, whatever, like Eastern Asia, in a specific year. To measure like these regular migrants, we use data from Permanent Observatory on Immigrants, but this is like an additional analysis. This is not in our main analysis. How much time do you have?
Really, no, we are.
Like 10 minutes?
Yeah, that's good.
Okay, so let me move to the, like this is just the descriptive statistics. Also here in panel A, you can see the stock of migrants. So here you can see the stock of non-European migrants, the blue line, and then you can see red line, stock of European migrants, including Romania and Bulgaria, which entered to the European Union like, during this period. And then the green line will be stock of European Union migrants, excluding Romania and Bulgaria. So here we are using as control group only the green line. We do not use the red line because specifically like Romania and Bulgaria they entered during this time period. In the panel B, you now see our main measures of the net flow, clean of nationalities acquisition, and also normalized by stock in 2008. All right. So what we see here, like of course stock are very dramatically different and so on, but once we construct our measure, which is sort of like normalized by size of the country, by size of the stock, actually we see that starting from 2008, these three groups of countries were following quite similar patterns. Like in all these countries, the net flows were falling down until 2013. Then in 2013, they started to go up, associated of course with the economic recession. And it started to go up much more for non-European countries, okay? So which would be against our welfare-market hypothesis, because if anything, we should expect that they should fall down more than for European Union countries. So in the descriptive data here, there is nothing like this is just descriptive data. We don't see evidence. So let me move to the differences. Estimates, so here you see like 8 columns, so 4 columns. Columns from 1 to 4 show you the OLS results. Columns from 5 to 8 show you the synthetic differences results. So here we use 2 periods for the post-treatment year. So we use 2012 and 2013 to measure like very short run effect, and then we also include 2014 to measure like a little bit longer run effect. First column includes 2012, second column, for example, doesn't include 2012 because 2012 was partially treated, because the policy was introduced in April, no? So it was not completely treated. So what we see that if anything, like once we include 2014, the effect is actually positive. We can reject actually the negative effect in this case. And we find something very similar with synthetic differences. So the largest effect that we find is, the largest negative effect we find is with synthetic differences in difference. Column 6 is minus 0.025, so this means like 2.5% decline in stock, like relative to 2008 stock. But this effect is not statistically distinguishable from zero, and clearly, like by 2014, it gets recovered. So we already don't see any effect once we include another year. And like I think much easier to see these results from this figure. So this is dynamic difference effect with our main strategy. Here we see that until 2011, they were following, like the two groups of countries were following similar trends. Nothing happens in 2012, nothing happens in 2013, and then, if anything, the effects are going, like, the non-European flows are getting bigger than, are getting more positive than European trends. So here, because I don't have much time, I will like show you just very fast one thing, because I will not discuss too much like that. So this, what happens if we exclude 2 countries, if we exclude, oh sorry, this is not, it's not. this. So, like you can see this, like in the original strategy, you can see this positive effect, no? And here what we thought, like it could be that after the reform, some countries of origin, non-European countries of origin, experienced shocks in their countries which sort of pushed them to move to Spain. And we know that specifically like Latin American migrants usually would choose Spain rather than other countries, no? So what we, of course we all know that there was a crisis in Venezuela going on. But for example, in Honduras also there was like a massive crime and massive out-migration. So when we exclude these two countries, when we exclude Honduras and Venezuela, we see that basically this positive effect disappears. So it becomes, first of all, like the scale of the effect, the Y scale becomes much smaller, and the effect ranges from like minus 0.02 to plus 0.02, so the effects become very nice zero effects. All right, so
that's panel A without that.
Exactly. Panel A is without Venezuela and Honduras, and panel B is without Venezuela, without Honduras, and without asylum seekers. Because also, like it could be because of some wars or shocks in countries of origin, there were like an increase in asylum seekers. So when we exclude them also, like we don't find this positive effect. This for you just to believe that, okay, this positive effect that we find, it's not, of course, the effect of the reform. It's just because some countries were migrating to Spain for other
reasons. But it's never significant. It's never significant.
Never significant?
No, this is with all
this is the main, yeah.
This is not significant. I mean,
yeah, like you can see, like in 2014, there is something positive going on, but also the scale is huge. No, it's like until 0.55, which is huge because these countries like Venezuela, Honduras, they add a lot of noise to our estimates because they were migrating like very massively. And this is how synthetic differentiative looks. So again, here we don't find a negative effect. We see like that between 2011 and 2014, everything was very stable. So triple differences. So here we add two other countries of destination. So we are going to compare these differences in Spain to these differences in Portugal and Italy. Okay, so we are going to estimate this model. Here we are again regressing these flows of immigrants from country of origin O into country of destination D in year T on the triple interaction. On the interaction between being from non-European country of origin, migrating to Spain, and year after the reform. And we are going to control here for triple three-way fixed effects. So we are controlling here for fixed effect for country of origin, country of destination. Like for example, for the fact that Colombians will always move to Spain, not to Italy or Portugal. We are controlling for country of origin T, year fixed effect. So this would allow different countries of origin to follow different time trends. And we are controlling for country of destination year fixed effect. So this allows Spain, Portugal, and Italy also to have different, for example, different effects of economic crisis. So let me just directly show you the effects. Here what we see is again, like between 2011 and 2014, there is nothing much going on. After that, if anything, the effect becomes positive, but again, like here we should check what's going on if we exclude Venezuela and Honduras, but I'm pretty sure that like when we exclude Venezuela and Honduras, it's going to be much more flat. Alright, so additional analysis, I don't know how much time I have, let me just show you this last analysis about comparing, like, let's forget about European Union migrants, because maybe you don't buy that they're comparable. Let's focus only on non-European migrants, non-European Union migrants. And let's divide them into two groups. Like one group would be countries with high stock of irregular migrants, another group will be countries with low stock of irregular migrants. No? So here you would expect that policy affected more countries with high stock of irregular migrants. So here what we did is we used the data on permits prior to the reform, and we compared all the migrants to legal migrants. And the difference gives us a proxy for the stock of irregular migrants. All right? And we just divided the countries above and below the median by the stock of irregular migrants prior to the reform. Just like as a validation exercise, we compared our proxy to the proxy from the survey data. The thing is that this survey data is available only for 1 year, only for 2007, so we cannot use it to study the dynamics. We see that the correlation is super high, so our proxy looks like it measures really stock of irregular migrants.
Sorry, but this data that you mentioned to complete the share, is it at the municipality? You have it at the, so unit of observation is municipality?
Our data or the survey data?
So, go on. So you said that the statistics on vouchers and permits and the municipality.
So in principle, we can have it at the municipality level, I think. Yes. We are using it at the national level here.
Because I was wondering if, because at the end you have 300 observations, I was wondering if you had the data at the municipality level, you would have much more power to.
Yeah, for sure. Like we want to do it. Like this is the next thing that we are planning to do. Like we want to go into autonomous communities level. We want to compare autonomous communities that were like more affected and less affected by the reform, because what you said, that in some autonomous communities they didn't implement the reform. We didn't do it yet. Yeah.
I should have asked before, but so this policy was just like from one day to another. It doesn't matter if you were, I don't know, having a treatment. If you are irregular, you don't have access to healthcare, or it was like staggered, like also first at the national level or at the autonomous community level. So the healthcare system has some time to apply the policy.
If the health system,
and if it was heterogeneous across.
It was heterogeneous, exactly. It was heterogeneous across autonomous communities because some of autonomous communities just didn't implement it. They said that they are going to implement it. Yeah, exactly. So this variation that we want to use now, we want to try to use it. We still don't have these results. All right. So just to show you the results, and I'm done. This is how the results look when we compare migrants from the countries with above median share of irregular migrants and below median share of irregular migrants. So here, if the Madrid effect is true, we should expect this result to go to be negative. We don't see any negative effect. So we get, if anything, like in 2014, it's negative, but it's not statistically distinguishable from zero. Starting from 2014, we actually can reject the negative effect. We don't see anything going on there. So here, for that reason, we conclude that it's unlikely that there was any effect of the reform. So, in principle, I'm done. I don't know if you want to ask questions, so I conclude. So, here in this paper, we studied the effect of this 2012 health reform in Spain that restricted access to healthcare to irregular migrants. We find no evidence that this reform deterred migration, irregular migration. Any migration. Other studies have shown that this reform had actually quite bad effects on social outcomes, like for example mortality increased, self-reported health, how people perceive health system got worse. People could not report intimate partner violence. So for that reason, like if anything, the overall social effects or welfare effects of this reform were quite negative. Okay. Thank you.
I have a couple of questions.
Yeah.
One is when you do your triple difference analysis, I imagine that the migration to Spain is very unbalanced because it's full of people from Latin American origins, right? So I wonder if you take care of this somehow?
So not really. Like look here, for example, you can see like Spain, Portugal, Italy before, after the reform. So we don't see that it's super unbalanced. Like we see that before the reform, this is just raw data again. No? We see that before the reform, they were following similar patterns in Portugal and Spain and Italy, for example. They were following like similar trends all the time. You know, so it doesn't look like they're super unbalanced. But as you said, yeah.
More than pre-trans, I mean the composition, right? Because this composition is very different, right?
But the unit of observation for us is always country of origin, no? So
I see.
exactly. So it's not the overall. It's always just one country. So it's not really affected by the composition. Yeah.
So to nationalize the effects on so the paper that you mentioned that finds like increases in mortality rates.
Yeah.
Is it in Spain?
Yeah, the same reform. Yeah.
So do they do some heterogeneity by type of death? Because I would assume that if you take out the, like, if the regulars cannot access the healthcare system,
Yeah.
but they can access emergency, pregnancy, and kids.
Yeah.
All this, I would assume that these deaths are from diseases that require preventive care.
Yeah.
Right?
Yeah.
So
Sure.
maybe like there is no change because people don't internalize
Yeah.
on the long-term consequences of not having access to the system.
It could be, exactly. It could be. To be honest, like, I'm not sure. I'm pretty sure that probably they did because they published the paper quite well, so I'm pretty sure that they checked by that type of death, and I think they had like a sort of good data on health. I mean, this day my colleagues so I can ask them, and I can read the paper again. To be honest, like, I don't have an answer to your question right now on top of my head, but I will definitely check it
No,
out.
it's just to rationalize your finding because
No, for sure. But I totally agree. I think it's just like for them, probably it's not the most important thing. That's it. Like they think about other things, and you're already here. You don't really think that much. Okay, I'm using healthcare. You know, maybe to money they would respond differently because we can send money to their destination countries, but they respond differently to healthcare. That's it. Yeah.
So given that the reform took place in the middle of the economic crisis, I guess that the immigration in Spain was not too high, right? And also because you said like 800,000
That's
lost
very
their
good.
healthcare. The way I see your paper is more looking at the out migration, whether there's been out migration as at this point.
Yeah, exactly. Yeah.
But in that sense, the problem I see with I was telling you about the blog is that, and you mentioned it, that many people live, they're still in the background. In fact, I think that it takes 5 years or more for the people to kick you out of the padron.
Not if you are irregular. If you are irregular, or if you are like a migrant, if you are not native, you have to update every year.
Exactly.
I know because I was in like a situation, like when I was with my student card, I remember that every year you would receive a letter that you have to update your padron. And here, like in principle, we expect that the effect is driven by irregular or If you are native, that's true. Like you are in a padron, if you're local or irregular.
No, because I also have another evidence. Someone who was taking care of my parents, and she was in my parents' place, but she was not living there for quite some time.
But she didn't
in that case, my point was is not valid. But my point was that that would be concerned that the embargo, right, has some measurement error.
Could be,
because
sure,
there's this inertia, right?
Yeah, could be. Like it would be perfect to have some other measure, no? Like to arrivals, for example, we don't have this data, but if you find something like some.
But then I don't know. Have you looked at the differences, some heterogeneity across countries of origin? Because also, probably there were some countries of origin that were more responsive to COVID, right?
We could do that. Yeah, we didn't do that much heterogeneity. We could do that because our control group is quite homogeneous, you know. So it's a bit difficult to think like how we can separate them, no? So to find, like, for example, low-income countries in the control and in the treated group to run like a good heterogeneity analysis. So it's not really clear in our context how to do the heterogeneity analysis.
And then the other thing you can do is to focus on the main minor groups.
We sort of always focus on the main, like we delete the groups with very, very small stock of migrants. Like maybe we include like 60 countries in total or something like that.
That's still 60 there.
There
are three main.
Like, there is a trade-off, no, in the number of observations. If we delete too much, like maybe we have a few observations and everything's going to be noisy. But then, like when we move to autonomous community type of data, maybe we're going to restrict to less countries. That's true. Yeah, that's the point. But yeah, I do agree. Like the measurement error issue is like the most important, I guess, here. But no clear idea like how to control. As I said before, like now we are planning this survey, so we're gonna try to ask them about this kind of information, like whether you are registered, whether you asked to update your registry, whether you, for example, it's denied your registry. We're gonna try to collect this data if this survey idea works, because it's quite hard to know.
Any other question?
Thank you.